Well, let's talk about what's going on. We're joined now by Dr. Danielle Bryden from the Faculty of Intensive Care Medicine, who's also an ICU consultant, and Will Broughton, who's a paramedic and trustee at the College of Paramedics. And thank you both so much for joining us. Danielle, I want to talk to you first because I know that you're due to start a shift today. Just give us a sense of what it's like for you.
Well, my shift will start at 8 o'clock this morning, and the normal pattern would be to find out how the patients that are directly under my care have got on overnight and plan their care for the day ahead. But increasingly, we know that there will be increasing numbers of patients being referred to us from the wards, and so we have to factor in how many patients we're likely to need to admit to critical care in the next 24 hours. So we're constantly looking at the resource we might have available in the next 24 hours and what the demand is likely to be.
Right, so many questions to ask you. How many of those patients are COVID patients?
Well, we know that we've got more patients in hospital with COVID this time than we had in the first wave, but we've also got patients in intensive care who would be in intensive care in the winter anyway, people that have had heart attacks, road traffic accidents. So we're trying to run two sorts of intensive care units at the same time with increased demand across all hospitals for intensive care beds for COVID patients.
And Will, from your perspective, I understand that you're self-isolating at the moment because your wife has COVID. So first of all, how is she and how are you?
Thank you. I'm fine. My wife's improving. We should finish a period of isolation today. So as soon as I have another sort of negative lateral flow test, then I'm hoping to go back and do some frontline shifts, as I know my wife will, as soon as she can.
Okay, that's good to hear. Do pass on our best regards to her. And I know you're working over a very busy Christmas and New Year period. Give us an idea of how that time working as a paramedic in London, how that compared to sort of previous winters.
It was exceptionally busy compared to certainly winters that I've experienced. We know that with winter pressures every year, there is exceptional demand on the NHS, but this time it did feel different. Patients were waiting far longer for ambulances to arrive in some cases, and the amount of time that we were spending at hospital waiting to hand over a patient before we were able to then leave and go and see another patient was ever increasing. So the pressure on the ground, it felt far busier than we've ever seen in previous winters.
And we can see pictures now of various ambulances, and we know that there were ambulances sort of queued up outside some hospitals at least. So what sort of time frame are you talking about? How long was it taking?
So in some cases, we've been told by members of ambulances waiting up to 5 hours to hand over their patient at a hospital. On a number of occasions over the Christmas and New Year period, I was waiting between sort of 2 and 3 hours in some cases to hand over patients. And the unseen part of that delay is that for all the time that an ambulance is at hospital waiting to hand over, then there is a patient or a number of patients at the moment in the community that are waiting for ambulances to come and attend them. So we're holding still high numbers of calls for people who are waiting for an ambulance, and we're attending less patients per day because of the time that we're waiting at hospital. So we're doing our best with all of our partners, especially in the emergency departments, to try and make sure that we can offload patients as quickly as possible.
You may not be comfortable answering this, Will, but I suppose the question is, and people at home will be thinking, were our lives being put in danger because of the queues, for example?
There's certainly a risk that people will deteriorate, that people will become more unwell because they're waiting for an ambulance to arrive or waiting for a space to become available in the hospital. So we're starting to see an impact of the lockdown restrictions at the moment, and all we can really do is encourage people to continue using our services wisely, using NHS 111 online as a sort of first port of call, so that those who do have serious illnesses or life-threatening emergencies, we can still make sure that we can get ambulances to those people in a good time.
And Danielle, how are you? How are some of your members of staff there dealing with what's going on in the ICU at the moment? Is that something you get the opportunity to talk about?
We are very concerned about intensive care staff because many of them have been working full pelt since last March, the beginning of last March. And not only are they very tired, they've had COVID themselves, many of them, or isolating. I think the psychological impact of what they're doing is quite considerable on many of them. And perhaps one of the more concerning things is the fact that people are not always wanting to talk about it. If you ask somebody, how are you, they might say, I'm okay. But you know they're not okay. It's just that it's easier to say you're okay and carry on than it is to talk about what you've been experiencing. So it is a concern.
And presumably there are so many things that you're dealing with that you didn't have to deal with before, and one of them, not least of which, is families, trying to help families who perhaps can't come into hospitals as well. That's been,
I think, one of the hardest things that anybody working in intensive care has taken from this. The difficulties of communicating with family members who are not able to come and visit their loved one, trying to explain to them how ill their loved one is, and then sometimes only allowing them to visit right at the very end of their life. It's extremely difficult, and nobody likes to be giving that kind of information over the telephone to people that we're not able to then support.
And I know you're going to you're going into your shift in 40 minutes' time. How do you feel every morning before you go into a shift? The sense of sort of how is it for you?
I think each day at the moment is becoming increasingly unpredictable, in the sense that normally in the winter we would know how many patients we have, and we would know how many we're likely to be asked to be involved in over the next 24 hours. But because of what's been happening with COVID and the rapid rise of COVID admissions, the referrals that we're getting from the wards are increasing considerably. So examples up and down the country, some people have had 10 times the number of patients referred to them than they would have normally. And that makes it really difficult to plan the day, to say how much you need in terms of staff. So it just becomes increasingly an issue of what can we identify as the likely resource we're going to need in the next 24 hours. And that means that we're very focused on making sure everybody's safe, but not quite knowing how much we're going to need to do.
Danielle, you said you started your shift at 8 o'clock this morning. How long's that shift today?
I finish at 9 o'clock tonight.
Okay, well, we hope you have a good day, a decent day. Thank you very much for your hard
work. Thank you on behalf of all of your patients as well. Thank you very much indeed, both of you, for joining us here on Breakfast. Thank you.
It's Danielle Bryden, who's an ICU consultant, and Will Broughton, who's a paramedic in